50 common medications that can destroy your kidneys. Kidneys are vital organs that perform crucial functions like filtering waste products, balancing electrolytes, and regulating blood pressure. Despite their resilience, kidneys are vulnerable to damage from various sources, including medications. Many commonly prescribed drugs, over-the-counter medications, and even some supplements can inadvertently cause kidney injury, leading to chronic kidney disease, CKD, or acute kidney injury, AKI. In this video, we explore 50 medications known to potentially harm the kidneys, providing crucial information to help you safeguard your renal health. 1. Non-steroidal anti-inflammatory drugs, NSAIDs. NSAIDs, such as ibuprofen, naproxen, and aspirin, are widely used for pain relief and inflammation reduction. While effective, they can reduce blood flow to the kidneys, potentially causing damage, especially with prolonged use or in high doses. 2. ACE inhibitors. Medications like lisinopril and enalapril are used to treat high blood pressure and heart failure. Though beneficial for many, they can lead to kidney impairment, particularly in individuals with pre-existing renal conditions. 3. Angiotensin II receptor blockers, ARBs. Similar to ACE inhibitors, ARBs like losartan and valsartan help manage hypertension but can also cause kidney issues, necessitating regular monitoring of kidney function during use. 4. Diuretics. Often prescribed for high blood pressure and edema, diuretics such as furosemide and hydrochlorothiazide can lead to dehydration and electrolyte imbalances, straining the kidneys. 5. Proton pump inhibitors, PPIs. Used to treat acid reflux and GERD, PPIs like omeprazole and esomeprazole have been linked to an increased risk of chronic kidney disease with long-term use. 6. Antiviral drugs. Medications for viral infections such as acyclovir and tenofovir can cause kidney damage, especially in higher doses or prolonged use. 7. Antibiotics. Certain antibiotics, including aminoglycosides, gentamicin, and vancomycin, are known for their nephrotoxic effects, requiring careful dosage and monitoring. 8. Chemotherapy agents. Drugs used in cancer treatment, such as cisplatin and methotrexate, can be particularly harsh on the kidneys, often necessitating preventive measures to minimize renal toxicity. 9. Immunosuppressants. Medications like cyclosporin and tacrolimus, used to prevent organ transplant rejection, carry a risk of kidney damage and require regular renal function tests. 10. Antifungal medications. Some antifungals, such as amphotericin B, are notorious for their nephrotoxic potential, demanding cautious use and monitoring. 11. Lithium. Used for bipolar disorder, lithium has a narrow therapeutic window and can cause significant kidney damage with long-term use or overdose. 12. Bisphosphonates. Drugs like alendronate used to treat osteoporosis have been associated with acute kidney injury in rare cases. 13. Contrast media for imaging. Intravenous contrast agents used in CT scans and MRIs can lead to contrast-induced nephropathy, particularly in patients with pre-existing kidney conditions. 14. Anti-tuberculosis medications. Drugs such as rifampin and isoniazid, used to treat tuberculosis, can cause renal toxicity, particularly with prolonged therapy. 15. Anti-epileptic drugs. Medications like valproic acid and phenytoin, used to manage seizures, have been linked to kidney damage in some cases. 16. Antidepressants. Certain antidepressants, like venlafaxine, have been associated with renal impairment, especially in high doses. 17. Antipsychotics. Drugs like risperidone and olanzapine, used to treat mental health conditions, can adversely affect kidney function, particularly with long-term use. 18. Allopurinol. Used to manage gout, allopurinol can cause kidney stones and renal dysfunction in susceptible individuals. 19. Statins. While statins like atorvastatin are essential for managing cholesterol, they can occasionally lead to rhabdomyolysis, a condition that damages the kidneys. 20. Sulfonamides. Antibiotics like sulfamethoxazole, used to treat bacterial infections, can lead to crystal formation in the kidneys, causing damage. 21. Methotrexate. Used for cancer and autoimmune diseases, methotrexate can be nephrotoxic, especially at higher doses. 22. Antiretrovirals. Drugs like indinavir, used in HIV treatment, can cause kidney stones and chronic kidney disease with long-term use. 23. Thiazolidinediones. Medications for diabetes, such as pioglitazone, have been linked to fluid retention and kidney damage. 24. Beta blockers. Used for high blood pressure and heart issues, beta blockers like atenolol can sometimes impair kidney function. 25. Antihistamines. Certain antihistamines, such as diphenhydramine, can cause urinary retention and kidney stress with prolonged use. 26. Proton pump inhibitors, PPIs. Commonly prescribed for GERD, these drugs, including pantoprazole, have been linked to chronic kidney disease with extended use. 27. Calcineurin inhibitors. Drugs like tacrolimus, used post-transplant to prevent rejection, are known for their potential nephrotoxicity. 28. Herbal supplements. Some herbs, such as aristolochic acid found in certain traditional medicines, can cause severe kidney damage. 29. Analgesics. Non-prescription painkillers, including acetaminophen, can lead to kidney damage when used in high doses over time. 30. Penicillins. Certain penicillins, such as methicillin, have been associated with interstitial nephritis, a condition that can harm the kidneys. 31. Aminoglycosides. These antibiotics, like gentamicin, are highly nephrotoxic and require careful monitoring of kidney function. 32. Radiocontrast agents. Used in diagnostic imaging, these agents can cause nephropathy, especially in those with pre-existing kidney conditions. 33. Calcium channel blockers. Used for high blood pressure, drugs like amlodipine can sometimes lead to kidney dysfunction. 34. Antimicrobials. Certain antimicrobials, like amphotericin B, are known for their kidney-damaging effects. 35. Antiarrhythmics. Drugs like amiodarone, used to treat heart rhythm problems, can sometimes impair kidney function. 36. Antiviral medications. Drugs such as ganciclovir, used for cytomegalovirus infections, can be nephrotoxic. 37. Antirheumatic drugs. Medications like hydroxychloroquine, used for rheumatoid arthritis, can sometimes lead to kidney issues. 38. Anti-migraine medications. Drugs like ergotamine, used for migraine relief, can cause kidney problems with long-term use. 39. Chemotherapy drugs. Agents like cisplatin, used in cancer treatment, are known for their nephrotoxic effects. 40. Immunotherapy. Newer cancer treatments, such as checkpoint inhibitors, can also pose risks to kidney health. 41. Antidiabetic medications. Some older antidiabetic drugs, like metformin, can cause kidney issues, especially in those with pre-existing renal conditions. 42. Osteoporosis treatments. Drugs like zoledronic acid, used to strengthen bones, can cause kidney damage in some cases. 43. Gout medications. Medications like febuxostat, used to manage gout, have been associated with kidney issues. 44. Muscle relaxants. Drugs like cyclobenzaprine, used for muscle spasms, can cause urinary retention and kidney stress. 45. Antifungal treatments. Medications such as voriconazole can be nephrotoxic, especially with prolonged use. 46. Cardiovascular drugs. Certain heart medications like digoxin can lead to kidney dysfunction. 47. Hematopoietic agents. Drugs like epoetin alpha, used to treat anemia, can cause kidney issues in some patients. 48. Antiparasitic drugs. Medications such as chloroquine, used to treat malaria, can be harmful to the kidneys. 49. Erectile dysfunction medications. Drugs like sildenafil can sometimes lead to kidney issues, particularly with overuse. 50. Weight loss medications. Certain weight loss drugs, like orlistat, can cause kidney damage with prolonged use. Understanding the potential kidney risks associated with various medications is crucial for maintaining renal health.